Hello everyone. When it comes to stomach cancer, there is no one size fits all approach. The treatment is entirely dictated by the stage of the disease, which essentially tells us how deep the tumor is and how far it has grown. We generally divide the journey into three distinct groups. First is an early stage tumor, which is basically stage 0 or stage 1. In this stage, the tumor is small and confined to the inner lining of the stomach. If we catch it at this stage 0, which is a very superficial tumor, we can sometimes perform an endoscopic resection. This involves passing a tube into your throat to peel the tumor off the lining of the stomach without any external cuts. However, if the tumor has grown slightly deeper into the stomach wall but without any lymph nodal involvement, which we call stage 1, the gold standard is surgery or gastrectomy. We remove either a portion of the entire stomach along with the nearby lymph nodes to ensure all of the cancer cells are gone. The next is a locally advanced or stage 2 or stage 3. This is where the tumor has grown through the stomach and spread to the nearby lymph node, but it has not spread to the distant organs. This is where the things become a little complex. The standard of care is something which we call a multimodal approach. Surgery alone is usually not enough. We typically sandwich surgery with chemotherapy. This is called perioperative chemotherapy. The usual flow is part of the chemotherapy is given before surgery. This is basically aimed at shrinking the tumor, followed by surgery, and once the patient recovers from surgery, maybe in a month or so, we finish the rest of the chemotherapy. In some cases, we may also use radiation. The next stage is a metastatic or a stage 4. In this stage, basically the cancer has spread to distant organs like the liver or the lungs. In this stage, surgery is rarely curative. Instead, our focus shifts to systemic chemotherapy to control the disease and to extend life. This includes chemotherapy, but increasingly we are using something called immunotherapy and targeted therapies like Herceptin for HER2 positive patients, which attack specific markers on cancer cells. To summarize, in early stages, surgery alone may be enough. We combine chemo and surgery for middle stages, that is stage 2 and stage 3. And lastly, for advanced stage 4, we treat with systemic chemotherapy alone, as surgery is ruled out in view of distant organ involvement. It is true that the treatment is complex, but with precision surgery, both laparoscopic and robotic, and precision chemotherapy, the outlooks are much better than before.